In and Out with Professor Yalman at Radio TED-U Ankara, TED University Studios. And here we are again with a very interesting episode where we want to talk about, not Galatasaray, no. Yeah, we're at the round of 16 at UFL Champions League, but that's not our subject today. It could have been actually, but it's not. I have a wonderful guest, dear student of mine, Aybüke is here.
Hello.
And welcome. Why don't you introduce yourself?
Okay, hello. This is kind of interesting for me because I am kind of new to these kind of topics. I'm Aybüke. Hello again. I'm software engineering student who is enthusiastic to explore the world and looking for the new kind of aspects around the world. And this is why I am here to talk with you, because you are an interesting person, and I guess.
But you guys are more interesting than I am, you know.
Yes.
Yeah. So see, the way this flows is these microphones and this room is some sort of magical, because
Wow.
as soon as you are here, and even though you haven't done something like that, the atmosphere and the setting sort of pulls you in and shapes you towards something. And so you're pulled in right now. What we're going to be shaped towards, we don't know. So let's see. Okay. What is sort of keeping you awake these days?
Kind of, I've been journaling, so this is my new idea and new topic, like just me. And I've been thinking about there's a book which is from the Dr. Burns, Feeling Good in the Turkish. And there's that part there's 10 topics around here, and I saw that all of my perspective changed when I apply on those onto my life. So do you know what is
No, I don't know what the perspective. I don't know what you have applied. I'm interested to know. So, what did you do? What did you apply to your life?
what?
What did you sort of read and apply to your life? What was the recipe?
Okay, there's in the recipe that he basically wants you to apply the 10 question how you think about it. Let's say you are depressed or something like that. There is a 10 questions, 10 topics, and at the end, you are really recognizing that in the sentence of that yes, this is the topic of that. Let's say you are using the melimalı, should a lot. So this is the one of the topics. Or let's say there is another one, labeling, for example. You are, let's say, saying yourself, I am a very hardworking person. This is the one of them. So at the end, I've been doing this almost about 3 months, and all of my perspective and thinking about how life is going on, all of them are changed. And I started to wondering what is going on, and I'm starting to look at myself. It is really interesting for me because I never believed something that occurs me in a really rapid way. Do you know what is going on in that book? Did you read that?
No, I didn't read the book, so
Because
I'm very
this
curious.
is really popular, and he is probably the professor psychiatrist that started the cognitive therapy. So it is kind of, the book is about repeated itself 80 times.
So it was republished 80 times?
Republished,
Okay.
yes.
Okay.
And it is really interesting for me. I've been still working on that because book is still really thick, and there's a second book at the same time.
Okay.
He said that we can resolve depression if it is not coming from the genetics. They can solve it. We can solve it because it is all happening of how you're thinking and how your habits of your thinking, how your mechanism works. And this is really interesting for me because I never thought about that it will work for me, because I am a patient who's suffering from depression for several years. It's a doctors are occurred that yes, you are depression.
Okay, what is depression for you? How would you sort of define depression from your perspective? So if you say, I suffered from depression, because everybody understands depression in a different way. So
unfortunately, the popularity is occurring at the psychiatry. So it is the common saying that it is so common to say that yes, I am severely having trouble with the psychiatric issues or the depression or the anxiety. It is really common, but in a medical way or in a
Yeah.
cultural way, it separates from it. So firstly we should understand what is going on. If you have a tendency to suicide or give yourself some harm, it is really going on something else. And when I look at that, my family perspective, there is a pediatric reports that
Okay.
is depression occurring. So when I go to psychiatrist, yes, he confirmed that yes, you have some psychiatric issues.
So when you're depressed, what do you feel? What goes on in you?
It's an interesting question because nothing goes on you.
Okay.
Because yes, you think like that, oh my god, I need to do something, life is going on, but no, I do not have even energy to put my finger on up, something like that.
Okay.
It is really interesting and hard issue, and you do not want to live, especially in the pandemic. It is really interesting. I felt that, oh my god, this is the life of that I always wanted and adored, because there is no one, no issue, no work to do. So at the first it felt like that, oh my god, this is the chance that I might be feel good, but it wasn't like that, because at the end, at the some time has occurred, passed, it wasn't felt like it put me in the deepest part of the life. I did not feel anything. Actually, with the help of the doctors, you are using some kind of pills. So,
Yeah.
okay. And you do not feel anything, even the sadness. And in the end, I thought myself that I want to feel anything, even sadness. At the end, I was begging for the felt something.
Yeah, but I want to understand something.
Yes.
It's very interesting topic
Mm-hmm.
because a lot of the students are using anti-depression
Yes,
pills.
it's really common.
Even my generation, there are a lot of people who are sort of using even lighter ones, or they're like they're doing drugs or they're having alcohol, whatever. They're trying to escape this. But you're very brave to have pinpointed this, that you have like identified, you said, okay, I am in depression. I have to do something about it. And you went to the doctor, and now you're very brave to talk to me about this right now.
Yes.
So this is very nice. But this is what we should do, actually. We should enlighten and inform the public and people around us from real examples. But again, I want to elaborate on deeper on this. So once you had no energy to do anything and you felt nothing, okay?
Yes.
So when you go to the doctor and they prescribe you a pill, and you're saying that you didn't even further feel more, right? I mean, you were not feeling anything anyway. So what does the pill do to you?
This is the action of the
Okay.
pill. At the first, you were suffering from what is going on in the chemicals of your brain.
Okay, what was going on in the chemicals of your brain?
It is really hard to describe, because you are suffering. First of all, you said yourself, you are blaming yourself
Okay.
about, yes, you are suffering yourself, don't do that to yourself.
All
But
right.
it is not like that. Then you realize that my thinking mechanism, my brain doesn't make me allowed to feel optimistic, let's say,
Okay.
to understand the people, but it is actually not describable as I wanted to.
Okay.
At the end, the pill make you feel nothing. It is really hard to describe. And as a further go, you started to want it. I want to get rid of even the pills, because I want to feel something, even sadness that made me suffer before. And
Okay.
it was challenging, because even you wanted to feel something, even sadness. It actually, I heard that when I search for the internet, I saw that people around me, medically reported people, their examination goes like that. Their flow goes like that. First, they have a parents flow issues. They have medically reported, and after that, they are using some pills. I saw that one of them using electrochemical, kind of shocking. They are using on the brains, and they are making the. Do you know what is going on in there? Probably you would know. At the electrochemical therapy, they saw that people who severely suffer from the depression, they cannot go. What's called that in English? Let's say there is all of the colors in the television goes that, and I got
They go colorblind.
now. My body got shaking and I cannot feel anything. What?
Illusion?
Not the illusion. This is a disease. This is a disease. Let's say there is a.
What's it in Turkish?
Türkçesini
You
de
don't remember.
hatırlayamadım.
Anyway, okay. So
They saw that they cannot go that nöbet situation, so they pushed the brain to get that nöbet, to give the electrician.
is it called epilepsy?
Yes.
Okay.
Oh my god.
All right.
Epilepsy. I didn't remind. The epilepsy is kind of like that. They saw that depression couldn't make you epilepsy,
All right.
so in order to get rid of the depression, they found that if we give the electricity into your brain, we can maybe get rid of the depression.
So let's assume that the therapy worked and the pill worked, or the other therapies worked, and then you started feeling again, right?
Yes. But
So,
it's a hard
and then what
process.
happens then? Then do you get like anxiety, or do you get what how do you deal with that?
Okay, there is actually it's a kind of Russian doll. It's one of them. If you want to get rid of one of them, the inside of them are enlighten itself. So when you in my journey, I get rid of the pill,
Okay.
and after that, I did start to feel something. Eventually, it is kind of a loop because I wanted to feel something, and in I found the energy of the life that
Okay.
I always wanted to have. So there's a courage started. After that, I really wanted to be healed. So
Okay.
as a result, I go to therapy, but we cannot say that yes, therapy all the time works. It doesn't work. If you want, yes, there might be, but it is a kind of a chance that you might find yourself meeting with a bad therapist.
Okay.
It is kind of happening, and as a result, almost 10 years, it is starting to change. First, you start getting rid of the depression. Let's say thinking thinking bad, it goes away, and
The
after
pessimism
that,
goes away?
Pessimism goes away.
Okay.
Yes, and after that, the anxiety starts. What am I doing? What if my actions are led me to go back into the depression? This is kind of sad because every and each of your step in your life make yourself to doubt about what if I go back? What if I go back? As a result, you are having trouble with the socializing with the people.
Oh my God, this is like a
hard.
battle that you're going
Yes.
through, and
Definitely.
a battle with yourself, but also I'm not calling the battle as in a negative format. I'm using the word battle in a positive format, that you have the courage and you're brave enough to sort of face this and
Yes.
go through this. And the amount of years that you're talking about, like 10 years, 15 years, whatever. And I heard like a couple of people who have been dealing with this like more than 20 years, and they want to get well, this desire, and then they talk about this loop as well. But I think it must have been very difficult for you, for example, to sort of make friends, as you said, but even go to a class where you're challenged, or like my class. Oh my God.
Yes.
And
Do you remember that how I talkative and how I describe myself like that?
yes. Yes,
Yes,
I
it is
remember.
obvious.
And well, it's very important for partners, professors, family to understand this and help you in a way help you pave your journey in a solid ground. Like imagine you're going out with somebody and you love that person dearly, okay, and she says she's in severe depression, and what are you going to do? You're going to leave that person, or you're going to be like sticking together and going through that together. I think leaving is the easiest way, and it's a very selfish way from my perspective. I think if you truly love somebody, all right, and you want their well-being, and but then it is going to be very difficult for the person who's there both ways, actually, because then your brain might be saying, what am I doing to this guy? What am I doing to this person?
It is
And
always happening, by the way.
yeah, and the other guy would be saying, am I missing on in life right now? Do I
Yes.
have to put up with this, etc.?
Uh-huh.
So my question is, how do you deal with being open in your friendships and relationships, etc., when you're going through something like this? What would be your advice to people, actually?
Oh my God, it is really hard question. And I can say that I've been still dealing with that situation. And I can still see the part of stains of those depression that leave behind of me. And I'm still trying to get rid of them. And it is really important that, first of all, I was, when I felt okay at the beginning, I was trying to help people. However, I found myself in the relationship between therapist and talking people, like something like that. And this is kind of hierarchical, something like that. And it is not healthy at all. At the end, in the Turkish way, I find myself in the middle of their, let's say, life. I wasn't living in my life because I was so cared about them. However, they cannot live their lives as well. It is really hard. And I started to think myself, yes, I'm kind of a mentor for them. They're kind of a mentee. What is going on? Relationships, friendship is not going like that. And in the end, I felt myself, because I was pushing myself to help them because I felt empathy for them. However, in the end, I felt immediately, in the sense of that, pity for them because
I see.
I have the courage to solve the situation. However, they are using me as a wall to be, orthogonal to life, to strong in their life. It is not the case. And I am finding myself in a position that I'm finishing my friendships because there is no equality in them. Yes, at the beginning I thought that I was the lower one because of the depression, anxiety, whatever, it doesn't matter. But now I am the mentor of them that is not feeling equal. Relationship must be equal. In the end, how
Does it have to be equal?
yes.
So this.
If it is not your mother or parents or something like
So
that.
if in a relationship, changing or shifting the subject to another angle.
Okay, it's going interesting.
If in a relationship, if somebody if one party loves the other party more, okay,
One who?
like if one person
Okay.
loves the other person more,
Okay.
and the other person loves that person less,
Okay.
or let's say that person says, time is not right for me. You're a great person, but time is not right for me.
To meet up or something.
Not just to meet up, but
Having relation with them?
to pursue the relationship in the format of giving and caring and
Yes.
all that,
Okay.
romance.
Or something like that.
So there is inequality. So this relationship should finish, erode,
In my
from your perspective, of
equation,
course.
Okay. In my equation, if I fill my cup all around, I probably waited along too much time. And in the end, if I patiently wait, if this relationship goes well or not, I can see the results. So it doesn't matter whether it is the perspectively this person likes each other or not. It doesn't matter. If I wanted to care her or him, whatever, the friendship or the relationship doesn't matter. If my patience of the cup of the fill already overflows, it's done. It's done. How I
So it's patience.
yes,
The
definitely
level of
patience.
patience.
I think it's a not good habit because you've at the beginning you recognize what is going on and you can tell that yes, I already experienced this situation and I can see what is going on. However, I need to wait. Let's see. Maybe I do not know her or his personality.
So should somebody wait patiently or not?
No.
No.
Yes. Currently, I'm saying not always yes. Let's say not always yes, because if you do not wait, you might harm yourself. Because relationships are, in a flow. Not we can say it is rigid.
Aha. So
Yeah.
you're saying not just equality, but more so flow.
Yes,
The
definitely.
the flow, the fluidity should be there.
Yes.
So if the fluidity is there, but let's say if the person has a very valid excuse saying, look, I am not psychologically or in terms of I'm just healing from my traumas, and I'm not psychologically there, and
Is she or he harming me
passively.
passively? And
Because
she or he doesn't
passively, let's
recognize
say,
it.
of course, active harming is bad.
Okay.
Active harming, it should finish. But let's assume that there's a passive harming.
Okay.
Passive harming in the way of that person is indifferent.
Okay.
Okay? Indifferent.
Uh-huh.
But trying, but indifferent. Trying but indifferent, and he or she wants time. So would you be still in this side of the woods or neck of the woods where you say, no, this has to
I
be
recently
finished or
something
done?
occurred something, yes, and I finished, but it's happened really, really beautiful way. So I said to her and him at the same time. It happened at the same time, at the same week.
Okay.
Because my patience left at that time. Because I said myself, I am the person of that living this life, and I'm the yes, we are at the same time main character of this life, and it is not at the same time. However, if I living for myself, that I want to get on a step for myself as well.
By the way, we're not just talking about love and girlfriend-boyfriend relationships. We're talking about any relationship here, right?
That I can have credit of myself.
Yeah.
I still did not solve those complexity of the
I see. Okay.
credits.
Okay. So, in this process of
I want to ask you something.
Ask me,
about
yes.
that. Yes, because we are talking about only one way. How do you solve the? Let's say you have a relationship with you might have a credit on yourself. Let's say, yet. Let's say there is a person that he has a project,
Okay.
and you see that yes, if I involve his project, that's if I make him to love me, I can involve his project and I can make some credit. Let's say this is the world. This is what is
So
going
I
on.
can gain some brownie points.
Yes.
Attention. I can sort of get some attention of that person.
Yes. This is really interesting because
This is for me
this is the rule of the world. By the way.
sneaky.
Yes, definitely.
So what's the question? Because I can answer. So far, I can give you an answer. First of
Okay.
all, I would never do that.
Okay.
Whatever my intention is, I would tell that person. Okay?
Okay.
I would tell that person, look, I like you, or I love you, or I want to do this project with you. Whatever my intention is, I wouldn't sort of use something to be something. Okay? So
However-
I would be open and I would say, look,
Okay.
like, let's say if this is a boyfriend girlfriend
No,
situation,
this
and I'm
is kind
trying
of
to sort.
political.
What was that?
This is kind of a political because you are making network some kind of way. This is really hard for me to understand because I see that the people they are not in a relationship or having a kind of a bond between them, but they are making in order to gain some kind of title or money or
Yeah.
prestige
Yeah.
or something like that. And if you do not do that, if you do not make mess in your hands, you are not able to, in my experience, what I see, you cannot find a place in a prestigious place in the life. For example, title, for example, might be job. That is what I saw, by the way.
Yeah, but I still believe that being honest and
Yes.
not sneaky and clarifying your intention is, I think,
Yeah.
very important. But
But what?
have you ever played chess?
Yes, I do.
Okay. Life is sometimes backgammon, or sometimes it's like chess. Okay. Now in backgammon, you still have
is
to.
backgammon? I'm
Backgammon is tavla.
Okay.
In backgammon, you still have to know the game,
Yes.
understand the psychology of
Okay.
the opponent,
Okay.
but at the same time, there's also luck. But when luck comes, with a dice,
Okay.
you need to know how to play it.
Of course.
Okay? But in chess, you can be, in a way, very clear with your intention, which is I am going to beat you, I'm going to win. Okay? But you can play little games where you alter the attention of the opponent to certain fields or certain games where you actually practice your own objective on the other part of the board.
Yes.
So if you look at life as chess and backgammon, where you know what to play and you understand the psychology of the person, and at the same time you are trying to reach your intention with mind games,
Okay.
but you have declared this at the beginning, there's no problem. But if you don't declare it at the beginning, so you saw, sorry, so if
How
you
do you declare this? You say you're
you
saying
say that
I
like
am doing this to yourself or something?
no, you declare this. You like if this is like a job and you have a
Okay.
boss, you say to your boss, I want your
I
seat.
understand. Okay, I understand. Okay.
And if the boss is clever, he'll be happy about this. Okay?
This is really interesting.
Or
Relationship.
if you meet,
Yes.
look, or in class,
Okay.
if the professor is a challenging professor, you say to the professor, I'm going to be the best student you ever had. Or you can tell the professor, look, I really challenge you to make this course very interesting for me because I'm not interested in your course.
This is kind of manipulation,
Yeah.
definitely.
But manipulation is nothing bad. Manipulation is a technique, okay? But even if you're like using this technique,
Yes.
you got to be honest.
Okay.
Honest. Whatever your intention is, be honest. Like let's assume you like a guy, okay?
However, if you want to manipulate someone and you are saying that I am honest, they can understand you. So they cannot manipulate.
Of course you can manipulate that. It's
Oh
very
my God.
easy. Yes.
You are saying that?
Of course.
This is really
Let's say
challenging.
let's say you're
Okay.
let's say you meet a boy, okay?
Okay.
And he's gorgeous,
Okay.
okay? And the boy plays sports that you don't know and is interested in areas you don't know, and to be
Okay.
sort of seen by him, you need to sort of be in those fields, okay? In a way. It's one thing to show up and all of a sudden show as if you're interested in these things, but you're actually interested in the boy. On the other hand, you can just tell the boy,
Yes.
I like you. That's why I'm here. Usually
so
I'm not
direct.
interested in this shit.
Okay.
So this
Yes.
is also approaching that person, but not in a sneaky way, in a direct way.
Okay, which one do you think better?
I think my way, the second way. So I would tell that person directly what my intention is.
However, the first one is more common. So
Of course, because
I
people,
would choose the first one as well.
yeah, but the first one is the most common one because people are not confident. People are not feeling
No.
worthy. People are afraid of expressing their intentions and feelings. People are,
Okay, I understand.
people are trying to sort of escape
Mm-hmm.
certain situations. People are not brave enough, etc.
Okay, at the first one, I said the boy that I am interested in what's your hobby or sport, something like that, right?
Yeah, you don't even say yes.
Or
You don't even have to
make
say
me
that.
feel like that.
Make him feel like that.
Okay.
That's sneaky.
Okay, this is the affection
And then you,
of to let yourself to show him.
yeah,
your
but then
love.
and then you wait until
Yes.
you expect, actually, not even wait. You're
Okay.
there. You're in the first one. Your expectation is for him to say, "Oh, she's beautiful. She also likes the things I do. Let me approach her, etc."
But this is more healthy because
No.
if it is become directly, people might feel like that. Yes, this is my border, and she is making it some affection.
No, but if your
in
intention,
a hard way.
but your intention is at the end, the result is the same.
Okay, result is the same. However, we need to make some softness, put some softness in her.
No, you can do the softness later. Tell your intention directly.
Okay, I think you're wrong. Because why? Because why? I am the therapist of all of my girlfriends, and they all feel like that. Let's look at their Instagram DMs. Even mine. I
I think that's cheating.
It is not a cheating.
It
She's
is
not
cheating.
doing something like that. All the boys come here and follow directly. And she felt like that. Okay, this is out of my border. I want to feel soft, confident because of his softness. And they want
You
to
can
feel
still
like
be
that.
soft and confident, whatever, by declaring your intention of
Okay.
being with that person. Rather than playing games and having that
Okay, I
person
understand
discover
your
you.
intention. You say that do not play chess. Be honest.
Yes.
Okay, I understand your intention. But in a romantic relationships, we talk about the flow, right? I believe that we need to put some flow in it. So being direct makes the flow logical, not the emotional. So in the relationships, why we doing relationships? Why? Okay, let's put the money and all the strategic political things behind. Why do we make the
A relationship is a relationship only if it's real.
Okay, if it is real, why don't you felt like that? Even if you say it doesn't matter. At the first, you need to feel compliment of somebody.
Compatible, yes. Compatibility is important.
Yes.
But to feel compatibility, you need to
Yes.
sort of understand what your desire is about that person.
Okay, it is kind of a time passing process. So
Okay.
it
All
is-
right.
it-
It's a time passing process. Anyway,
Okay.
so we don't have to sort of break our heads about these things. Fine.
Okay.
So we spoke about depression, and then we
Yes.
spoke about how to approach each other, and we spoke also about how actually we go through these things in life.
Yes.
Aybike, thank you very much. This was
Thank
a treat from you to us, to our audience, because you're being very honest. You have brought to the table different issues, but I'm going to call this episode.
What?
I'm going to call this episode depression, but
so sad.
but I will attach some prefix to it.
How?
So I'm not going to say anti-depression, but some prefix to it. Let it be a surprise for you. when it's aired. But thank you very much for coming in and doing this
Thank you for
and being very
having me.
proactive and going through my classes actually with all your journey as you were like sort of facing, going through, etc.
Mm,
So what I learned from you is life is a dance. So you got to sort of
definitely.
dance this dance with fluidity and observations and understanding what you're all about. In and Out with Professor Yalman from Radio TEDU, Ankara, TED University Studios. One final word from you to our audience.
Have courage on yourself.
Be brave and have courage in yourself. And don't make anything become an expectation in life for you so you sort of blow your brains out. Life is beautiful, life is nice, life is worthy to have fun and explore your journey and your reason of being here, because everybody has a reason of being here. And
Yes.
we learned a lot of things from you, Aybike, today.
Thank you very
And
much.
thank you very
Very
much for
thank
being here.